Okay, so for the last, sort of talk of this session, we want to give you guys an update of what has come out of the carrier research that Cindy and I have been doing. So I think I wanted to start by sort of addressing carrier issues in the Barth community and where we've really come from over the years. It really has been an evolution, and I've been looking back through my notes from this meeting. I've been coming to this meeting since I think it was 2002 was my first one, so I've been here at every meeting since the very first one. Although admittedly, that very first meeting, I think I was brand new to Dr. Kelly and probably didn't do a whole lot other than follow him around and just try to absorb what was around me. But since then, pretty quickly after that, I have been meeting with mainly initially focused on meeting with the siblings, the female siblings in our group, and talking about the decision of inheritance and being a risk for carrier and carrier testing. That was really where I think I started with this. I look back in 2010 was the first talk where I gave a talk about carrier issues to the broader Barth group, not just in small groups to the girls. And that again was still focused on carrier issues, but there was a slide in that presentation, and I'm a pack rat like that, so I have them all, where we actually did talk about some of the psychosocial issues that can come up in the idea of being a carrier. It was one slide, it was a short list, but it was there. And I think that maybe is what started getting us talking about some of that. It was then from there more of a gradual over the next 2 years, but in 2014, we really launched forward and jumped forward with the launch of the Barth Carrier Services Program. And it was in the 2014 meeting where we first had the first formal conference programming for Barth syndrome carriers, and we really moved beyond just talking about carrier testing decisions. And I think that is huge, and I think that this foundation is to be commended for that. This is not something that is out there in many of the other X-linked disease organizations, the support groups. It's very focused on medical treatment therapy for the boys, and that is still the focus here, right? At this meeting it is. I'm not saying that it's not, but it doesn't mean you can't take a step back and think about some of the other ways that this disorder impacts your lives and your family. So I think we made these lately, and I made these, I think, before the last meeting, so I don't know if they've changed, but this is what we have written down. Basically, the goal of the Carrier Services Program is to educate BSF members about carrier issues, to work to provide support and resources for women who are facing carrier issues, and that assure that we are addressing and supporting the needs of potential carriers as well. So some of the big highlights before we get into what the research has shown. So having that carrier programming was an amazing experience for me as a genetic counselor, for all of you so openly shared sort of the struggles and challenges and things that you faced that really helped feed the development of the research that you're going to hear all about. So the big themes that had come out of the sessions in 2014 was there was a lot of discussion about guilt, most often in the context of passing or primarily passing, the idea of passing a change to your children. There was a lot of discussion about the lack of understanding or acceptance by others, and that was a broad category. It included family, included friends, and even medical professionals. We had many women or several women share stories where they were just completely treated poorly and judged for the decisions that they were making, reproductive most often about in the context of future children and in the context of Barth syndrome. We had some comments about stigma and feeling like being a carrier made them different in some way. We talked about the impact that it can have on relationships, both significant others, siblings, parents. Also a little bit about starting new relationships, remarrying, things like that, maintaining current ones, the stress of the diagnosis, but also the implications that the diagnosis is genetic and is coming often through the mothers, the stress that can have on a marriage and things like that. Who, when, how do you talk to people about being a carrier? Do you need to talk to people about being a carrier? And that differs for everybody. We talked about a lot of fear and anxiety, especially during pregnancies. This year in a session, somebody used the word that they felt very powerless when they were facing some of those reproductive decisions. And I just thought that was a really a strong word and very telling word. and the idea of, do you have more children, do you not have more children, and how do you go about doing that if you want to utilize it? So this was really kind of the highlights from that session. And then sort of to kind of talk a little bit more about the reproductive challenges, because I did at the 2014 meeting, they had asked me to give sort of a top to bottom list of all of the reproductive choices. So we had definitely talked about how it's a very complex and sort of expanding field of reproductive decisions and choices, and that there's no right answer, and that the use of these or lack of use of these is very personal and very unique for every family and individual. And so there's prenatal diagnosis being used for maybe delivery planning, just knowing, and some women will choose to use prenatal diagnosis and terminate. There is pre-implantation genetic diagnosis. Some families choose to adopt. Some families choose to use IVF techniques and use egg donors. Some people choose to have no children or no more children after they learn the diagnosis. And some families choose to not use any technology that we have available and still have children. So there's a huge spectrum of choices that are out there. This is really just a list and not going into a lot of detail about them. We're going to share some highlights from the phase 1 of our study. And Cindy's going to come up and talk us through that, and then we'll wrap up a little bit.
All right, this is my part of the talk, and before I launch into it, I'd really like to thank the Barth Syndrome Foundation, to thank all of you for participating in the study, but also for making me feel so welcome here. This is my first meeting. I'm very grateful to Becky for involving me, and it's really been a delightful experience. I've been in genetics for nearly 20 years, and really this is one of the most impressive meetings I've ever attended, so thank you. All right, so on to the research. So as Becky said, following your meeting in 2014, the BSF realized not only were these concerns, but this was an understudied area. There's really not all that much out there in the literature, and put out a request for applications called asking us to propose studies focused on the impact of testing positive as a carrier, as a Barth syndrome carrier. So we developed a study with 2 overall objectives. First, to characterize the nature, frequency, severity, and predictors of experiencing psychological and reproductive challenges. And second, more globally, for the foundation, really providing an evidence base for improving support for carriers, both within this community and in the broader community of healthcare providers for this and for other excellent conditions. So this is a 2-year, 2-phase study. The first phase is qualitative. The second phase is quantitative. This is what they call a mixed method study. You often use this approach when the existing data in the field is really not enough to develop testable hypotheses. So first you need to explore, and then you need to test. So right now we just finished phase 1, which was semi-structured telephone interviews of, at this point, 28 mutation carriers. We subjected this to qualitative analysis, and really the goal is to explore experiences and develop hypotheses. We will be starting phase 2, AIM 2, next month. We are actually taking sign-ups for participating in the questionnaires now, and this will be a questionnaire for all adult women in Barth families, women who are carriers and women who are not carriers, because as you imagine, we're trying to now separate the experience of being a carrier from the experience of simply living as a woman in a family with Barth syndrome. So we want all women, regardless of carrier or not a carrier, you don't know, but you have to be 18. This will be a quantitative study designed to test hypotheses. So here we are, AIM 1, the qualitative part, identify and describe common psychological challenges. So that's AIM 1A. AIM 1B, our goal was to describe attitudes toward, experiences with, reactions to decision-making about reproductive options. And 3, we're going to explore how women derive support from other carriers, both within families and throughout the Barth syndrome community. So we recruited women through the foundation. Some of you may have seen emails and Facebook posts about this study. So our colleague Layla, who is a genetic counselor, not known to any of the women in this community, conducted the telephone interviews. These were recorded, transcribed, Becky and I double-coded them using consensus coding and then entered them into qualitative analysis software. I'm happy to talk about any of the details of this, but this is sort of standard qualitative analysis. So who participated? Like I say, we've done 28 interviews so far. Some of you in this room may well have been participants. We succeeded. We were trying to get women across the lifespan, and I'd say we succeeded in getting a wide range of ages, although almost half of women were between 30 and 40. Half of women participants were American, but another third came from other English-speaking countries, so the UK, Canada, Australia, so on. And then 5 very brave women who were not native English speakers actually were kind enough and brave enough to participate in a telephone interview with a stranger in a language that wasn't their first language, and I'm so grateful to them for that. So we have an international experience. Most people who participated were mothers of affected boys, although we had a good number of sisters, and then there were 5 women who were both mothers and sisters of affected boys. And most women in our study had learned their carrier status either while family building or before they had even a first child. And only about a quarter learned their carrier status after the reproductive choices were complete. So one theme that did emerge, which I think had implications in the long term for some families, was for a lot of people, carrier testing was fait accompli, and there wasn't a really long decision-making process. And that was particularly the case as part of the diagnostic process or shortly afterwards. So here's a woman who said, well, I think she, the healthcare professional, the doctor, would have given me the choice to say no, but she kind of said, hey, you probably want to know you're a carrier, right? And I thought, well, yes, absolutely. So we just didn't really even hesitate. And I think that may be the experience for many people, particularly when Barth Syndrome has been diagnosed while a boy is in a cardiac crisis. For other women, it was just simply an obvious step in planning pregnancy. So this is kind of opposite of what we just role-played, where this has been a thoughtful, long-term decision. In real life, unfortunately, that long, thought-out decision didn't really happen. So here someone says, no, the test for me was inevitable because I wanted to know. I didn't want to be blind and not know. And it was just something I had to go through for the pregnancy I was planning with my husband. So I'm sure this will not surprise this audience, but remember, aim 1A was specifically to look at common psychological challenges, and overwhelmingly the one we heard about most, which I'm highlighting here, was this issue of carrier guilt. It was common and occasionally severe, but by no means universal. So about 2/3 of women described feeling guilty, and here's the woman says, well, the rational part of me knows there's no sense in it, but I think the emotional part still feels guilty, and I know if I found out my daughter's a carrier, there'll be an element of guilt there for sure. On the other hand, absolutely, there's women that said, I don't feel guilty because it's not something you can control. On to reproductive decision-making, which we heard a lot about, and I think as we modeled today a little bit, and you guys have lived through, for almost everybody, this was a difficult decision-making process. Here's a woman who says, I really wondered whether a marriage could actually take it. But again, it wasn't a difficult decision for all. Someone says, it honestly wasn't very hard for us to grapple with that decision. In her case, it was actually more difficult to talk to their son about it. So our findings overall with regards to reproductive decision-making in your Barth community was there really were starkly different views and choices we heard from families. So there were different views between families, which I'm sure you know. There were actually different views over time. So we interviewed several women who had made different choices in different pregnancies or had made a choice and then over time had thought through it and changed their mind. And then there were differences of opinion between generations. With sisters, sort of like that last role play we just did, in general, sisters and aunts more open, more likely to consider preimplantation genetic and prenatal diagnosis than women who were already mothers of affected boys. And so this is a sister who says, well, I think you're in my generation, well, like me at least, I think it's a bit of an easier decision because there's no kid to explain why you're doing that, if that makes sense. So barriers to reproductive decision-making came in 3 areas. For some folks, it was an issue of simply lack of information, lack of knowledge, lack of awareness. really people had made decisions not even aware of the options that existed. There was also a theme of occasionally there being too much information too soon. So several women told us stories of being in the hospital with a critically ill child and some staff member coming in and sort of regurgitating reproductive options to them, which we heard some stories about how angry and frustrating and inappropriate that was for a lot of people. And so the right information at the right time, I think, is the theme we would like to push for. There was also barriers, of course, to access. For some people, they were aware services existed, but they were hundreds of miles away. For many people, there were financial barriers. This wasn't covered by insurance. And for some of the non-US population, we heard of barriers relating to a wait period for services. So several European women said, well, you know, I'm already in my late 30s, and it's like this 3-year wait to be able to get pre-implantation genetic diagnosis. I'm obviously American. I don't know the context, but that was a barrier for them. There was also barriers related to getting support for this decision. We heard a lot about the difficulty, the heartfelt decision-making, specifically regarding considering pre-implantation genetic diagnosis and whether that was a choice for the family. And there's 3 quotes up there to illustrate some of that, but I could have put 20 quotes up here. This is something we heard from a lot of folks on. And so this is, I'll just read the first one. This woman says, well, am I saying a boy's not good enough? Am I saying I just want a daughter? And I'm saying that another child, like her affected son, no, I don't want that. It was quite horrible, actually, for me and my husband. It wasn't nice, because it was almost as if he, the physician, was saying that let's see what else we can have. And it just didn't feel comfortable for us or right for us as a family. And someone said, you know, that was actually something I wrestled with for several years, and it was never able to come to terms with that for me. I just really have a strong faith that my belief is that life begins at conception. And again, there's a quote of somebody else struggling with this over years. All right, moving on to the third aim, or the third sub-aim, which focused on support sources. So we heard wonderful things about support folks get from the Barth Syndrome community, and now that I've had the opportunity to join you this week, I understand why. People got support from their family, their health professionals, and for some people from their clergy or their church. Although, for none of these categories did we hear only glowing things and no conflict. For all these sources of support, there were challenges as well as benefits. So what did we hear? We heard strong community support related to the medical and practical aspects of Barth syndrome. So they understood your concerns, that you didn't need to understand your worries. We also heard that interacting with other carriers for many women was helpful for sort of acknowledging and coming to terms with and dealing with feelings of guilt. So this says, guilt and distress associated with carrier status were ameliorated via interactions with other carriers. And so this one woman says, you know, talking with some other carriers helped as well, just hearing that other people experienced carrier guilt, because there really isn't anything online about it. I was surprised. At first I thought it was something I made up, like I'm a carrier and I'm guilty. It must be carrier guilt. And I did some internet searches and I couldn't find anything. But then at the last conference, it became kind of a big topic, and that was helpful and well-timed, because I was already starting to feel a bit better on my own, and then having these other people to go through the same thing was helpful. There's also a few women we talked to, particularly older women, who said, yeah, I don't really need carrier support. This is not something that's really salient issue for me. She says, well, maybe my situation's different because I'm on the older end of this. You know, I just don't really feel like I need any support, I guess. So one thing that I think is worth considering is the role of the BSF community in reproductive support. So despite the strong need acknowledged by many for support sorting through reproductive options, most people said they were wary actually talking about it with other carriers. Although the few that had ventured into that area had generally found it helpful. So it was more of a fear of approaching the issue rather than a bad experience. To be clear, almost everyone we talked to, and this is without prompting, I didn't ask this specifically, nearly everybody stressed that their own personal choices shouldn't be normative for others. So this woman says, I'm pro-choice for other women. That's just a personal decision I made. It doesn't bother me. Somebody else says, well, I don't disagree with anyone. I think it's a very hard decision to make. Regardless of whatever decision you come to, it's hard to even get there. Many people feared damaging the important relationships by broaching these personal and potentially political topics. So here's a woman who says, I'm really worried about the group kind of like splitting, like, okay, here's people who are totally for technology and who would maybe abort a child or are going to do everything they can to have a child without Barth syndrome, and then we've got another strong group that believes it's God's will, and so on. And this last woman really summarized it. She says, I think we just kind of don't talk about it because we all feel differently. And I think if we bring up our differences, it could come off as us not supporting each other, and that's not helpful to anyone. And so why is community support specifically for reproductive choice so hard? These are deeply felt and intense personal choices. And so folks said, well, because everybody's in it, so nobody can be objective about it, you know. And somebody else says, well, I don't think it's hard because we have different concerns. I think it's hard because it's so personal. Support within families can be difficult too. We heard a couple stories of survivor guilt. This quote is from, a woman who was feeling somewhat guilty because she had the opportunity to learn her carrier status prior to her pregnancy, while her sister learned her status only after her affected son was born. And there are really, of course, generational differences. So woman told us, well, I'm really glad I didn't know, so I didn't have to make any of these choices or use any of those options. That's kind of one thing I can say. I didn't have to go through any of this. And so, of course, that's a change in technology and a change in awareness. So what next for our study? As I said, the first phase was to develop hypotheses and to explore issues. So we're moving on to phase 2 of the study. And then I know the next session is slated to talk about carrier support initiatives you guys might want to pursue moving forward. So aim 2, quantitative study, quantify the frequency and severity of difficulties, predict which women are at higher risk, and test hypotheses on the influence of family and social support. So we are getting ready to administer phase 2 questionnaires. This has been approved by our IRB. We have them ready for you. And so these will be administered online, although we can send you a paper copy with a stamped envelope as possible. So at the end of the session today, we are going to begin taking signups. Becky has some clipboards, and we'd be really grateful for your participation. So we are calling all adult female relatives for a study called The Female Side of Barth. And again, we want to understand the experience not just of carriers, but of all women. And that's particularly important because it helps us sort out what effect is just, part of being a mother or a sister of someone with Barth syndrome from what's an effect of specifically being a carrier. So we really need all women, not just carriers. The questionnaire will take at most 30 minutes to complete. Paper and electronic versions are available. Please feel free to talk to us or email us. We also have a shorter questionnaire for adult men with Barth because of this issue we just talked about today. We'd just like to explore briefly understanding and attitudes toward this issue of all girls being carriers. And so that's at most a 15-minute questionnaire. We can also send that electronically or in paper. We're also taking up signups for that today. And then just to close, I don't know if, Becky, should I close or do you want to close with this? We'll start to trade off. So this is, I think, where we go from the study update to really launching what do you all as a community want to do with it. So I will pass this part to Becky. This is what some of you suggested in the interviews without a whole lot of prompting.
So some of the sort of action points that have come out of some of the research and also the discussions of this group over the years. We have a much longer list, of things that we can help pull out over time, but we wanted to pull some of the most salient and relevant ones that we thought to share today as we go into sort of the next session where we're going to have conversations about where do we go next as far as developing and expanding upon the Carrier Services Program for the Foundation. So one of the first things that was mentioned was some type of carrier and/or reproductive issues listserv, or a way for women who are dealing with these issues to have a communication network. So there was talk at some point about developing, this is what one of the women said, talk at one point about developing a listserv for carriers. I think it would definitely be a big help, just somewhere where people know that they can go to kind of air any issues that they're having, and it would be a supportive environment. Someone else brought up the idea of one-on-ones or more of like a small group support session. So maybe, she said, maybe there'll be a small, quiet, even just one-on-one group that can form that will support people going through this. Primarily in this conversation, she was referring to making choices about assisted reproductive technology or PGD, things like that, and treatment, and going through that process, because I think that really that can have a place, and some people will want it and some people don't, and that's fine. But for those who would benefit from it, making it available, they thought it would be a great thing. One of the things, and we had definitely talked about this before, and it just hasn't happened, and we will make it happen, is the idea that having information or fact sheets available on the website, so that that we have a place for women to go where they can get the knowledge and the information if they want. So putting together a fact sheet about the different reproductive genetic testing options, a fact sheet specifically about X-linked inheritance and carrier risks for children. You're just making sure that there's somewhere where once we leave these meetings, people can easily go and get all of the concrete information that they may want, so that they have a uniform place to go for it. And that came up in several of the interviews as a suggestion, just sort of having that resource put together. And again, the one thing that was brought up, and we're not quite sure how to do this or how to incorporate this, but one thing that came up was the idea of a summary of what reproductive choices have been made by this community, and that it might normalize sort of that across the whole spectrum, those choices have been made within this community. And so, sometimes when we're sitting in the room, some people are more comfortable sharing their stories, other people are not. And so you may not be hearing that full spectrum of the choices that have been made, but knowing that I bet if we took a survey and got a list of whatever choices have been made and anonymize it, you would see that every choice on that list that I went through earlier has probably been made within this community. And that would be very normalizing and sort of help be supportive to women facing those choices themselves, because they could see that the options are all there and that they've all been viable options for other families. So those were just some of the bigger things that came out in our discussions. And just our last slide is our acknowledgement slide. So Cindy and I both work at Johns Hopkins in the Center for Inherited Heart Disease, and they've been wonderful and supportive of our work with the Barth community. And also I'm still at Kennedy Krieger. Layla is... Where is she? She's at University of Maryland now. At one point she was at Kennedy Krieger with me, and then at one point she was at Hopkins, but now she's at University of Maryland. But she was wonderful, and we're so grateful for her to step up and do the interviews. I initially thought I might do them, and then we realized that was probably not good, because I know so many of your stories so well, and then a few I might not know, and that it would have really probably influenced the interview process. So she was wonderful in stepping up. And we want to acknowledge the funding from the Barth Foundation with the IDEA grant that was awarded out to Cynthia James. And we're so grateful to all the families and women who've done our interviews and who will participate in phase 2, where we can get some quantitative data to kind of back up our phase 1. So thank you.